Techniques of hand. There is PA oblique, and lateral, which in lateral imaging we have two techniques. One is a fan lateral and one is a true lateral. In PA imaging of the hand, our patient must proceed at the end of the radiographic table. Our part position is nothing special. Our patient just needs to rest their forearm on the table with the palmar surface of the hand against the IR and touching the table. They will need to spread the digit slightly. Our central array is perpendicular and entering through the third MCP joint. Compared to other techniques that we went through, we would need to increase our KVP to 66. In PA oblique imaging of the hand, the patient must be seated at the end of the radiographic table. There are two-part positions for it. One is when our interest is the interphalangeal joint, and the other one is when our interest is the metacarpal area. For the interphalangeal joint imaging, we would need to place their hand on the 45-degree radius and so forth. For the other one, we would need to ask the patient to rotate their hand laterally so the fingertips are touching the table. The central array is perpendicular and entering through the third MCP joint. Our curvature is settled so that our radiation is 1 inch or 2.5 centimeter apart from all sides, and our KVP is 66. In lateral imaging of the hand, the patient, like any other technique, would be seated at the end of the radiographic table. They would need to rest their ulnar surface of forearm on the table with their hand in two lateral position. They need to extend the first digit and place it at the right angle to the palm of the hand. As an option, we can have the patient fan their fingers to reduce any superimposing of the fall edges. We would need to center the MCP joint to the IR and adjust the palmar surface of the hand perpendicular to IR. Our central area is perpendicular and our KVP is 70. We increase the KVP due to the increase of bone density in our wrist. In this technique, due to the superimposition of radius and ulnar's head, we have increased bone density in our wrist, so we need to slightly increase our KVP.